Well, hello there. Welcome back to the Aesthetic Angle podcast and YouTube channel, sponsored by Monarch Plastic Surgery, Skin and Wellness. I'm Dr. Paul Leahy. So happy to have my partner and co-host today, Dr. Lexie Sampath. This is the first one I've gotten to do with just only one other person. It'll be fun. Just have a conversation. Yeah, it'll be fun. Our topic today is going to focus on recovery from, we originally were going to talk about different types of procedures, but then that was kind of vague, a little too broad. So we decided we would focus on some tips and tricks recovering from facelift procedures. And so Dr. Sampath and I will try to, kind of talk through some things, some questions that we got, and maybe it'll help our audience kind of think about the procedure and like maybe the time of year they might want to have it and some thoughts about that. So, so it's Tuesday afternoon. We're filming today. Tell me about your day. Oh, it's actually Wednesday. Wednesday. I'm totally off. My goodness. Wednesday afternoon. Yeah. Tell me about your morning.
Well, I had a little bit of a nice, slower start to the morning and where I got to catch up on some paperwork. And then in the afternoon, I had a bunch of clinic patients.
Okay, good.
Kind of checking in with them.
Variety of things coming in today. Yeah. That's the fun part about our job. You never know exactly what's going to be there. I had some eyelid surgery this morning, and then me and Maggie had some lunch, and then we saw clinic patients too. So there's always something new that comes in. I saw two patients I had taken care of a long time ago for some breast surgery that wanted some kind of revisionary things done, and so it's kind of fun to kind of get to know them again. It's fun part about what we do. Having like a long-term relationship with people is good. So
that's awesome.
Well, let's see. How about we start a little bit. Some of the questions that Jen Parker Quinn, our marketing director, kind of came up with as things that she's heard that patients would like to know about. So we want to set realistic expectations for patients with any operation you're going to. That, of course, is key to what you and I do. Facelift surgery is certainly not unique. We want to make sure that what they're asking for is something that has a realistic, reproducible procedure that can get them to the result. Or if not, where else do we need to go?
Right.
So to think about. Well, let me ask you this question, because I always get tripped up on this. So, almost every time you meet some new patient, they very often will say, "What's the recovery for this?" Almost like it's a pre-printed things to ask your plastic surgeon.
Yeah.
And I'm always tripped up by that because it depends a little bit on what you mean by recovered.
Yeah, what do you want to be totally back to normal? Or are you wanting to be able to go to the grocery store? Or are you?
Yeah.
When some people are really active, and some are less active. So
yes,
variety.
Or do you mean when will you not even know about the opportunity, or when you not think about it? That's way down the road. But why don't we, I guess, get into it with facelift surgery and. If a patient comes to you tomorrow or today in clinic and said, I'm interested in how can I look younger? I want to look as young as I feel on the inside.
Right.
What can you tell me about the recovery from your surgery, Dr. Sampath?
Well, for initially you'll be pretty swollen and bruised. You can't really get around that. And then people have varying levels of discomfort. Some, it doesn't seem to be as painful as you might think. It's a big procedure, major surgery, to have. And then naturally there'll be bruising. And then you won't want to lift anything heavy. I say not more than a gallon of milk, for at least that first week, and then kind of ease back into more activity, as comfort allows.
I say the exact thing about the gallon of milk. It's an easy reference.
It is. I know. I Googled one time how much it weighs, and it's like 8 pounds or something.
Yeah, right. It's
I sometimes say 10 pounds, a gallon of milk, whatever.
Easy stuff. Easy to remember, hopefully.
Yes. Definitely don't do it before any big events or anything. So it's like the high school reunions coming up in a month. Don't get a facelift.
Yes.
So I like to kind of know their social, if they have any goals.
Yes.
To be ready by.
Yes.
Because that kind of, gets the the calendar sorted out.
Right.
There.
Yeah, that's tough. Sometimes you see people kind of get disappointed, like, oh shoot, I was thinking,
Yeah.
but that's okay. There's other things that you might be able to
Exactly.
do that are a little lighter, that kind of thing. What do you like to say to patients about when will I have the final result? Do you have a
Yes,
good
that's
answer for
like
that? I
the
know.
ultimate
Yeah.
question. So I tell them that 3 months, everything should be pretty settled. Swelling is mostly gone, but up to 6 months where you could still have some lingering swelling, and you really want, especially if you're doing like much neck, for it to really scar, reset itself
Yes.
to give you that good contour. So kind of, it's a wide window,
It
but
is. It
yes.
is. I'll just share with my experience with that is, and I learned this from a plastic surgeon I did some training with, and she works in New York City. And Dr. Monaco. I think I might have even talked about this before, but it seems like what results that you have at 6 months very likely will carry with you for a long time going forward because we've repositioned the skin and the tissues that are deep there, and so with that you're going to generate some scar, which in this situation is actually a good thing because it
Right.
won't stretch as much as normal tissues. But even between month 3 and month 6 you'll see some relaxation, some settling of the procedure, whether you want to or not.
Right.
And but generally I think that 6 month mark is a good, for me, is kind of a good window. Okay, good. You will have that result for a long time. So
Yeah.
maybe that's, if fully recovered is hard to say.
Right.
But
Yes.
I think, like in most of our training, it's, if you read the textbooks, a scar has matured or kind of reached its sort of endpoint in a sense about 12 months, usually, what I
Yes.
recall,
Yeah.
9 to 12. Plastic surgeons come up with some crazy studies sometimes. And I remember this one that stands out to me, that they somehow talked people into getting really controlled little incisions done by a surgeon on their forearm. And they compared, like different scar therapies you did and stuff like that. But on average,
Yeah.
it took about 9 months to get to a point where the scar for most folks was just like a little white line, as opposed to, like, if it has some pink color to it,
It's still healing.
you're still
Yeah.
healing. Yeah. And so anyway, that's kind of a little marker that I always remembered about. But in facelift surgery, when we start talking about recovery, some of the difficulty in this conversation is that a facelift may not be a facelift, may not be a face. In other words,
Yeah.
people
There's
do
a lot
things
of
different.
flavors, a lot of
Yeah.
add-ons you can. Yeah.
Yeah. You want to just talk a little bit about, for our audience, like, in your mind,
Kind of how I.
yeah, or maybe what are the 3 to 4 different kinds of surgeries that you might think
Yeah. Or
about?
things that I consider.
Yeah.
So first, there's a facelift and there's a neck lift, and they're kind of a continuum. It's similar incision, it just goes a little farther. And it really depends on what is bothering the patient. If it's kind of as we age, we get mid-face descent, so jowling, etc. Or is it their neck is really loose? And sometimes, and often it's both. But I like to key in on that. And then the other component is specifically to the neck. There's your platysma muscle, which is kind of like a fan coming down from your jaw, kind of towards your clavicles, and that can get loose over time. You can get separation. So keep that in mind. And then also, if you carry fullness or fat tissue right here, that can be addressed too. So sometimes you get other incisions that are kind of submental here to address the muscle and the fat in combination with these incisions. And then another aspect would be, you get laxity of your skin as you age, but also you lose volume. So sometimes we'll combine it with fat grafting to try to restore some of that. So I think of that.
Yes,
And then
yeah.
also with the face and neck lift, there's layers of the face. So you have your skin and there's subcutaneous fat. And then just over the muscles that, help you smile and move your face is what's called the SMAS. And it's a really strong fascia layer. That can be manipulated as well. So, kind of depends what their goals are and kind of what their anatomy is. Some people have like a heavier neck and they need a little bit more strength, so of that SMAS to really be manipulated to help everything suspend better. So they might be a candidate for what's called a deep plane facelift, where you go beneath the SMAS level and work on that one as well. Or you can
Yeah.
just kind of resuspend this mask, and that is a good option for people too.
Yeah. And so I thought it would be important to actually talk about that physical structure because you hear it now, especially if you're shopping, so to speak, for
Yeah.
facelift surgery, and you watch even a couple of YouTube channels, you'll quickly learn some of this anatomy, and so the SMAS is actually an acronym. It stands for this big long medical thing. It's called superficial musculo, so like the muscles you mentioned, aponeurotic. APO means fat, and neurosis is also like a tissue plane. And then the last S is system. So superficial musculo aponeurotic system. That's why we say SMAS. It's way easier.
Yeah.
But it is a true, well-defined
Yes.
layer of tissue that, like you mentioned, it carries some strength. You can put stitches in it. You can cut it. You can reposition it. All those things to help you, sort of get back to the structure you're looking for in the face. So, if you look back at the kind of, I don't know, I get this nerdy about the history of stuff,
Yeah.
because as soon as you hear about a new technique, you should look back and see. Someone might have tried that already.
New.
Exactly.
It's never new.
I love that. And so,
Yes.
I think that, people have gone from just what people call maybe a skin only facelift. So it's sort of truly a small incision in front of the ear, take some skin. It actually looks pretty good right in the beginning. The problem is
The longevity of that.
yes, it doesn't last very long. It's this simple, easy thing. But I think that's probably how it started. And then people said, well, we studied anatomy more, and you start to learn about these other layers. And oh, wow, look what happens to these folds here and the fat pads if I pull on that deeper layer, that SMAS layer. Oh, that was actually much more powerful.
Yeah.
Well, what if you take some of it out? What if you cut some of that out and then stitch it? Will it last longer? And then, like you mentioned, well, let's go under that. If that was powerful, what's below? Yeah, what's below there? And there was this plastic surgeon a long time ago, Sam Hamra, who kind of popularized this, what they call composite facelift. So he would go all the way to bone and start lifting all of that stuff up, and he had amazing results though. And anyway, I think a lot of us shy away from getting quite so deep, but that carries some other issues. But I think once again now the deep plane term has become very, very popular, and I think it depends a little bit on exactly what you mean when you do that. So I was talking to a friend of mine who's a plastic surgeon in Oregon this past weekend, and I said, what do you do? And he said, or what do you do for face deep plane? He said, the first question I ask is, well, why don't you explain to me what you think that means? What homework have you done? What does that mean to you? And I'll explain then, okay, well, this is why you might need that. Or maybe that's a little bit more elaborate for you. That kind of thing. So I think that was I like that approach, And so helping people sort through their interpretation of what the anatomy is and stuff like that.
Yeah.
But I think you do have to, like you mentioned, if you start working now on tightening the neck as well, particularly if you have to make another separate incision there, well, you can expect that it's going to add to recovery a little bit.
Yeah.
Probably some more bruising, a little bit more swelling, more discomfort, although facelift surgery is remarkably well tolerated.
Right.
You get
That's
a
what I
couple
said.
of days and, it's not so bad, truly, compared to other stuff that we do. So let's see. Do you like to combine anything? You mentioned fat grafting. Is there anything else you kind of have sometimes done with facelifts?
If someone is a candidate for eyelid surgery, that's a common. You're rejuvenating kind of the face and the neck. It's all a unit, so to speak.
Yeah.
So, yeah. And if they don't want to do it all at the same time, you can also stage it. But I think it does, if you're looking more youthful in one area of your face, it almost draws attention to the other area that wasn't addressed.
Yes.
So if they do need that, then I like to combine those.
Yeah, that's true. Yeah, that's kind of everything be in harmony and stuff. And I like that. Good example. Another thing I've done recently, a little bit more, has been what people kind of refer to as like a temporal or a sort of a lateral or outer eyebrow lift. Just adding a small extension to the facelift to come up into the kind of this part of your hairline. And you do have to free this up a little bit, but it moves up pretty well. Yeah. And anyway, it just gives a little bit more youthfulness, I think, to that part of the face. So anyway, I like that. It doesn't seem to add that much to recovery too. So the other thing I have had some luck with is doing things like to kind of resurface the skin or make the skin better.
Yes, I'm glad you brought that up. It's a huge component.
Yeah.
You know, if they feel tired and aged, is the skin.
Right.
Yeah.
Yeah. So for example, I like chemical peels, and I think it's a pretty quick little addition to it. You're already numb anyways.
Yeah.
And by the way, I didn't mention this at the beginning, but pretty much I would say 99% of our facelifts are done here in the office or right across the street here. If someone wants to go to sleep, certainly that can happen, or have more sedation, but those are done in a surgery center. But anyway, makes it very safe and actually more affordable too, for that matter. But let me get your opinion on this. So I think a lot of people, well, I've heard it said this way, a facelift is actually going and changing. If you want to redesign a room, for example, you're more down in the studs, you're more down in the structure of the face, or the thing you're trying to rebuild with the facelift, because that's when we're getting into that SMAS layer and all that stuff. But if you haven't really conditioned the wallpaper and the paint that you're going to see on the drywall, you may not get the result that you're after. So
no, I totally agree. If you can have a better, less ptosis, sagging, and deflation, but if you still have, signs of sun damage or some of those lines that you would be able to treat with a peel or a laser, it just makes everything look so much better.
So, and maybe I'm jumping ahead a little bit about in kind of our order of things we're going to talk about, but I think if someone says, well, okay, this sounds great, I really would like to have this surgery with you. Tell me some things. Let's say I have 6 weeks before I would want to do it anyways, or more. What are some hints or some tricks that you would say to get ready for?
To get ready?
Yeah.
I guess just like for any procedure, to be in your most healthy state. So, eating well, eat a lot of protein, drink water. If you have any big activities planned, get those, if you're going to move or something, get that squared away. Yeah. What do you think?
Well, I just was recently, we've been talking about adding some skincare regimen in preparation for some of these facial procedures. Yes. Have you had some folks go through that yet, or?
A little bit. I know that we have, they use a retinol, and then vitamin C. Have them use that. Those are the big ones. And then if they're gonna have a laser or something around the same time, then there's its own little pre-treatment kind of protocol for that too, including the retin-A and so.
Yeah. So I'm really interested in that. I think that's a cool, really fun way to introduce patients to skincare, because you're going to want them on that right away after too, or as soon as they're healed, to protect the results and maintain that investment. So I'm really interested in what our estheticians can do, our injectors can do. Laura, our wellness provider, also, she can give some advice to people on being at their best weight and then their best form, that kind of thing. So I think anything you can do to okay, I'm ready, I'm ready to run this race.
The weight is a good point too, that we haven't talked much about, but being at your goal weights and you've been stable, because the last thing we would want is we have this beautiful result and then you lose weight, and while that might be good for your health, it might result in some sagging of your skin.
All this you worked for.
I know. So yeah, for sure, be at a stable weight.
Yeah. Well, we can talk about more kind of little hints and tricks and stuff like that as we go. Let's see. Let's now shift gears a maybe. Let's pretend we have done the procedure. We met. We had a consult. We were on the same page with our goals. We took pictures. We kind of drew out all our plans, right? And finally, we're to the day of the procedure. And our goal, of course, is to make you as comfortable as possible. There are a variety of ways we do that. Sometimes we can use oral medication, but I find a lot of people don't really even need it. Just local anesthesia works well. Yeah. It just, it's a process. But once you get everything numbed up on the face and the neck where you're working, or the eyes or whatever, most folks will you can rest, you can sleep. I'll talk to you if you'd like to talk. I mean, I'm probably boring, but I'll tell you stories and kind of get you through it. But it's sort of a fun journey that you go on. It takes a few hours. I mean, by the end of it, you kind of know each other pretty
Yeah.
well, so you're fun. And okay, so we got everything put back together. Stitches are in. We're starting to put on some dressings. Tell me about some of the dressings and things that you've liked over the years, or
Yeah, there's a couple different ones. The key is some kind of compression. So it can either have, get compression on the face, often on the neck, especially if you work there. And then they're all Velcro in several areas are interesting to put on.
I was going to say the same.
They're not very
thing.
fun.
I hate those.
Usually before that's on, we've kind of wrapped you up so that all of the incisions stay covered and are all sealed until we take it off the next day.
Yeah.
But anyway, there's different types. I like the ones that kind of go here and then they come over.
That's exactly what I like too.
Yeah.
To dread it is say dread it is too strong, but like we see each other's patients all out there, 7 of us, and you're seeing someone's facelift patient the next day, and it just says, hey, can you put them in a garment? I'm like, I'm gonna try. Me and Maggie will try.
Yeah.
It's all like you said. It's like getting a little baby into one of those old
I
onesies.
know.
Like, oh my gosh, their legs sticking out.
You get it on, and you're like, oh, I need to shift it a little bit.
Right.
You're like, okay, let's.
But they do once they're on, they are very comfortable. I will say that, and you want to have maybe a little space for some gauze and that sort of thing. But I'm kind of like you. I really like this one that's just a simple little kind of strap that goes like that, and you can get to everything you need, and it works well for me. But do you have a time frame you like for them to wear it, or what you say to them?
I generally for a couple weeks. Everyone's swelling's a little different. So I see you back at a week and say kind of, okay, you're doing better than normal, so you can kind of ease out of it. But yeah, what about you?
Yeah, so I guess the purpose of the thing is to, in my view, do a couple things. One is to hold some gauze pads in place, and just actually truly to give them a little security. Like, okay, I feel like I'm put together, and to not have anything would feel a little bit too naked almost, after this procedure. And then I think most plastic surgeons agree that like you mentioned, a little bit of compression wherever you need it to go will help control swelling. It might prevent a little bit of extra bruising, So anyway, that's what I'm trying to get out of it. I don't make it super crazy tight, just secure. So I will usually put it on after this, when they're leaving surgery, say, go ahead and wear this all day, all night. I know that's not fun. The next morning, I usually let them remove it and shower and shampoo. It works really well, I think. Yeah. You get some of the the ointment I got in their hair and all the crazy soap we use. It's sticky, and it itches. And anyway, wash that out. And then I usually will use some kind of an ointment of some variety on the incision for a while it's healing. And then I actually got this for my patients. That wasn't something I usually do, but people tell me, I'm going to go ahead and still wear that little thing you gave me, at least for a little bit during the day, because I feel like when I don't wear it, I notice it. I'm like, great. Okay, that's, I need to listen, And so that's kind of been my goal.
That's what I'm also, I'm just like, if you take it off and you are like, at the end of the day, I am more swollen than I want to be, then you can put it back on. Just play it by ear, which some people really do like a regimen. So we work together and figure out what they should specifically do. But I kind of like take it day by day.
Yeah, you're right. That sometimes
and it kind of holds stuff in place. But if you are doing well and you're not a big sweller, then maybe a little less time.
Yeah, see how it goes, right? And like you're like, I can't wear this thing at night. I'm like, that's okay. You do not have to. That first night I would like to.
Yes, yeah.
But because I find that the incisions do leak a little bit. It's kind of some fluid, a little bit of blood. Matter of fact, also protect your bed. Put some other old t-shirt down or those little Chucks pads. I like those things a lot. Just, so you're not mad at me the next day because your pillow or bedding is messed up. But anyway, it usually that's about 12, 24 hours, I feel. And it kind of settles down. But what do you feel about like ice packs after facelift?
I think that they're okay as long as they're not directly on the skin. Just because we've lifted it up, so you don't have that protective sensation anymore. So I wouldn't want to get too cold. But so if you have like a dressing or anything, it can help with swelling.
Yeah. Usually it's not gonna transmit too much cold.
Right. Exactly.
You're right.
I know.
You're right.
Yeah.
Yeah. I usually had kind of, this old thought about, okay, well, ice does make your vessels
Yeah.
constrict.
Yes.
Like when you go outside and it's super cold and your nail beds are, So, and usually in plastic surgery, you kind of want those wide open, especially like for like breast
heal,
surgery,
yes.
tummy tuck, stuff like that. So, I mean, I don't think it's the end of the world, to be honest, but I would probably try to stay away from it for in the first little bit. Same, but actually similar for heat. I mean, I don't know that you want to, for the same dangers, getting something too hot on your skin, you can't feel it. So, Jen had asked about, maybe you help me with this because I don't really know what this means, but there's like a roller device or something like that. Are you familiar with that? That people would do?
I think I do know. I think I don't have one myself,
Okay.
but it's like a stone or something that it can get cold, so you can put it in the freezer. So it's just like a little cooler, and I guess depending on how much pressure you put on it, it's a little bit of massage.
Okay.
I don't think it's bad. Again, I don't want it on your incision unless it's all the way healed. But I don't necessarily know that it would hurt.
Yeah. Okay. Same. Well, I need to probably investigate.
I certainly would tell. I wouldn't be like, you must buy this.
Yeah. Okay.
For
Good.
your
Good,
procedure.
Good. Or come let us do that for you first.
Yeah.
Our skincare estheticians, stuff
Right.
like that. I guess that goes also for like, I bet there are masks that are, you could put in the freezer, like when your kid hurts their, ankle or whatever.
Yes.
I get a lot, even the past year, a lot of questions about red light therapy.
I know. Me too.
Any thoughts you have about that?
I don't know if I've done enough research on it to make a strong opinion, but I don't have a red light mask.
Okay.
If that tells you.
Yeah,
You know what I
yeah.
mean? My husband works in dermatology, and we don't have a red light mask.
Okay. I think
Not to say it doesn't
it's
work.
Probably soothing. I'm sure
Yes,
it feels
I think it
nice,
does
right?
feel good.
So, I mean, if that can be worth a lot.
Yeah.
Is it really killing bacteria? Is it really,
Right.
decreasing inflammation and stuff? I need to research some more. And I have used a little bit of that light stuff over the years. When I first started in practice, there was one of the partners here. We had gotten interested in treating teenage acne,
Okay.
and far from being a dermatologist like your husband, but anyway, we'd see a fair amount of kids, that we could help. And there was this, I don't think it's very popular anymore, but it was called Levulan, and it looked like a little glass vial, and you it's one of those things like we use for adhesives, where you sort of break this thing and the little liquid come to a cotton point.
Yeah.
And they would do this at home. You could put it on the skin, and they would come here. We use blue light.
Yeah.
And something about the blue light and the way that this chemical
Yes.
interacted
Yes.
generated a lot of inflammation, like
Yeah.
a lot.
Yeah.
But it was really effective for acne, actually.
Yes.
But you have to put up with it. I mean, it's not fun for those weak and stuff. You heard of that before?
Not that specific treatment, but I do. I feel so bad because I don't know too much about it. I don't want to misspeak, but there is. I know that you can apply topicals and then they're activated by the light. So I think there are ways that the light can be very effective. I don't know if at home just using the mask reaches all those benefits though.
Yeah.
You know what I mean?
Yeah, I totally do. And like I say, I don't want to put it down. I haven't really investigated it too much. And if you have one, great, do it.
Yeah.
There's a lot of stuff coming out for like hair regrowth and scalp,
Yeah.
those kind of things. And I've seen, at least some emerging data. It might be better than placebo, so that's good. Well, let's see. Let's move into a little bit about, like, now you're a couple weeks more advanced after your healing. Okay, so we kind of got you through the surgery, through some really short, like 2-week recovery with the compression and that kind of thing. Tell me now, maybe give me some examples of maybe what you like to use on your scars at that point, or what you counsel people.
So scar care, anything. So topical silicone, been shown to, have flatter, fainter scars. So once the incisions are healed, there's no scabs, it's all sealed over, they can start doing silicone. I like the liquid, like there's different brands of it, like we have Biocornium and it has SPF in it, putting that on there twice a day. They also make silicone like strips or sheets. Those don't stick as quite as well on the face, but if that worked for somebody, they could use that too.
Yeah.
And then avoiding sun exposure. So I tell people, if your scar gets a suntan in the first 6 months, it'll hold on to it and it'll always be a little darker. It might be a little bit of an exaggeration, but I really I don't want it to get a suntan. So SPF or shade, whatever. And then scar massage, just like physically pushing the scar
Yeah.
flatter and making it kind of remodel in a more suitable way.
Yeah, completely agree. And fortunately, a lot of the silicone scar gels that are out will have an SPF in it, so it
Yes.
just takes off one little extra thing. Of course, you still need it on the rest of your face, but
Right.
yeah, I agree. I think those are the easiest thing to use. I usually say, I mean, don't make a career out of it, but you can apply it more than once a day. I mean,
Yeah.
maybe a couple, and
Yeah.
stoplights, so keep it in your car. It's fortunately that those products are coming down in cost. There's even
Yeah.
generic ones out. We, like you mentioned, we sell a version.
Yeah.
But anyways, you can buy it in a lot of drugstores too.
Yes.
So,
Yes.
and then, if you've really invested in some of the pre-treatment stuff that we did maybe before the surgery, like you mentioned, like the retinols and vitamin C and E, I think that from the way I look at those things, so the vitamin C and the E are going to be things that we call antioxidants. So hoping to repair or give the cells in your skin the ability to
Better
repair
capacity to heal in a way. Yeah.
from all the crazy stuff our environment
Yeah.
throws at us, And so if you apply that in the morning and with a good sunscreen, you're like protecting yourself for that day. And then maybe the retinol products are a little better at nighttime because it can be a little irritating in the sun.
Right. Yeah.
And the retinol will help you to turn over cells quicker, get your collagen layer a little thicker, your dermis layer, which we want because it plumps up our skin. To keep that in the best possible shape that you can. So,
Right.
So we talked about the silicone products and then a good sunscreen, a good moisturizer, and then you could, when we kind of coach you along, then we get back on that
Yeah.
stuff. So then people start, they get through this and they say, it wasn't so bad. I can't believe I did it. It's great. They're really proud. And that might open the door to other sorts of things that we offer in lots of plastic surgery offices. So things like Botox, fillers, those kinds of things, back to our wellness
Yeah.
thing and back to our estheticians too.
Yeah.
When would you let them kind of get back on a schedule with that?
I don't have a hard date.
Mm-hmm.
Do you have a hard date?
I think just like, for example, like the Botox or the fillers, I feel like you may need at least a few weeks, maybe even 6, but so you don't want to.
Fillers, I guess, would depend on where you're going.
Yeah, right.
But,
like lips would probably not be.
I mean, imagine
either.
like here, that I would wait a while,
Probably, you might not even need
cheeks.
it.
Yeah.
But like lips would be okay.
Fine.
Right?
Yeah.
Right. But I feel like Botox in this area, we're not going to touch that with any facelift. That should be fine.
Exactly.
I guess the risk or the theoretical risk that's out there is if you were to get that product into some bruising, would it just go away? Would it be carried away with the bruise? I mean, I don't know.
Yeah.
But I guess I would just say, save your money. Let's wait till you'll be able to do that. But then people like, when can I do microneedling?
Right.
I get back to my lasers. I want to get back on this or that, the other thing, or I had this planned.
Yeah.
Do you have a thought on that for facelift?
Oh, I don't know. If they're healing well and like their incisions are doing well, I feel like as long as it's not a really deep laser, they could do those superficial ones once they're, I don't know, like a month,
Yeah,
couple
I think so
months.
too.
I mean, it seems a little aggressive, but I mean, if they really wanted to, but as long as, the really deep lasers, when they get really swollen and puffy, that will need to wait because I don't want to mess up, we just made you swollen and you're coming back down. But the more superficial ones.
Yeah, same.
Okay.
I can't see any problem with that when you feel up to it. Well, how about then getting back to exercise is another common question. When can I go to the gym is a common.
Yeah. So I'm like, what do you do at the gym?
Yeah.
Do you walk? They're like, no.
Yeah.
In terms of, like running, I don't know, at least a month. Just because I want everything to be scarred down. I don't want you to have bleeding, a hematoma, etc. Similar for weightlifting. I mean, I think the key and what I try to emphasize to everyone is to ease into it. So I don't want you to go from 0 to 100 and you're going to go to the gym and expect to be back at whatever capacity, high intensity exercise you were doing.
Yeah.
So I'm like, okay, go light. Go for like half of what you would normally do and see how you feel the next day. Are you more swollen? Right? So
yeah, I think that's always been the scare is if you strained real hard with some exercise or something and then you got your blood pressure up too high.
Yeah.
Could you one of the blood vessels that had clotted off, could that come through, forward, and then you could have some blood under the skin.
It's also like you might just have more edema. I mean, you have swelling, and it doesn't necessarily change your end result, but it's annoying because now you have to get the swelling back down.
Right.
So it's kind of like just, exactly. So sometimes it's not even, sometimes it's dangerous, like the hematoma situation, and sometimes it's just kind of annoying.
Yeah, totally. We've covered a lot, kind of getting through people from even the consult up to you're kind of starting to feel recovered. I mean, kind of like, okay, I did this thing. I guess the other thing I didn't mention, what kind of, do you use any medications? Do you prescribe anything for pain or anxiety or anything?
So if it's in office, there's an option to have medicine for anti-anxiety. And then if people have like high blood pressure, give them something oral so that their blood pressure stays nice and even so they don't have more bleeding. I think some of that is, if you are going all the way to sleep, you have more fluctuations in your blood pressure versus if you're staying awake, but just to be safe so they don't have bleeding. And then afterwards, some pain meds. Some people don't need, or they just need it that first night, but just so they're comfortable.
Yeah. Yeah, it's remarkably. And part of the thing is that you creating some numbness actually because the skin has gotten numb. Little sensory nerves to the skin are moved or divided to remove it, right? But they will find their way back. It just takes a while. Even sometimes at 3 to 6 months, I'm basically back to normal. I have this one little spot.
Yeah.
And I'm like, well, that also just takes some more time, and it's not too annoying, generally speaking. But well, I mean, I think that's a pretty good overview of things that we would want our patients to know about when even before you come here to talk about facelift surgery, like, okay, what am I getting myself into a little bit? And then, then you get into the nitty gritty details about, okay, your specific case. What are we going to try to work on? I mean, what bothers you the most when you look in the mirror? And here's some techniques that we can use to help you get there. So,
yeah.
Well, all right. Well, thank you for being a good co-host today, Dr. Sampath. It's always good to chat with you. It was fun. It was just the two of us for a change too. So, well, thank you for joining us, everybody. We love doing these. We'd love to hear from you guys too. If you think of other topics that we're missing, that would be really, we have a list of things planned, but we'd love to know what you out there want to hear more about. We can certainly put that together. So we wish you all well, and please come see us anytime if we can help you. Thank you.